right, we're good. Are we good? All right. My name is Vidal, and today I'm going to be talking about reducing CAUTI in the ICU. Thank you for coming, and I hope this presentation is enlightening to you. Catheter-associated urinary tract infection rates in the intensive care unit have seen a steady increase in the last year. Evidence-based practice protocols and bundles provide opportunities for nurses to look at current practices and modify them to ensure appropriate care is being delivered. The statement of AHRQ's website promoting evidence-based practice is to provide evidence-based recommendations for diagnosis, prevention, and management of persons with catheter-associated urinary tract infections. These guidelines will assist as a baseline to initiate best practice in reducing CAUTI in the ICU. So we're just going to keep calm. I need to keep calm. And we're going to learn how to prevent CAUTI. CAUTI in the ICU. Why do we need to study? Why do we need to look at it? There's been an increased usage of urinary catheters in our ICU. There's been an increased incidence of CAUTI. There's only 1 month in 2015 that our unit had 0 CAUTI. And need improved bundle compliance. We're 52% perfect process. In 2015, 24 out of 7291 catheter days, we had a 3.29 rate per 1,000 catheter days for CAUTIs in 2015. So our goal, my global aim is to present an evidence-based protocol to reduce incidences of CAUTI in the ICU. I expect that by working on this problem, we will reduce incidences of CAUTIs. Evidence-based practice protocols and bundles provide opportunities for nurses to look at current practices and modify them to ensure appropriate care is being delivered. And evidence-based guidelines should be utilized in nursing practice to prevent and minimize CAUTI in the nursing care. So the guidelines, the protocols, and bundles, I chose two. I chose AHRQ and IHI. AHRQ guidelines are to limit unnecessary catheterization, removal of indwelling catheters as soon as it's no longer required, development of institutional strategies for infection prevention, alternatives to indwelling uteral catheterization, intermittent catheterization, aseptic technique, and sterile equipment. Prevention strategies after the catheter is inserted. And the IHI guidelines are these: to avoid unnecessary catheters, insert urinary catheters using aseptic technique, maintain urinary catheters based on recommended guidelines, review urinary catheter necessity daily, and remove pump. So the big question, what's the big question? The big old question is this: in ICU patients with urinary catheters, with implementation and compliance of evidence-based bundles, decrease infection rates by 20% on a monthly basis. So that's my question that I'm trying to work on. All right, from 7 to 1.5 in 8 months. This 38-bed hospital in Minneapolis, Minnesota, that took a comprehensive approach to their CAUTI, their life cycle. And this is what they implemented. They implemented preventing unnecessary placement, aseptic insertion, proper maintenance, prompt removal, preventing replacement. In doing this and following these guidelines and being compliant with these bundles, their CAUTI rate steadily declined from 7 in January 2014 to 1.75 in August 2014. There's another hospital that had no CAUTIs during a 12-month period. There's an adult care medicine, a 28-bed general telemetry medicine unit that implemented a CAUTI prevention bundle that included verification of appropriate circumstances to insert urinary catheters, the use of appropriate insertion techniques, meticulous maintenance procedures, and removal at earliest opportunity, and appropriate competency evidence-based training for all relevant staff members. They had no CAUTIs, or there were none attributed to the unit during 12 months of 2012, so subsequent to the implementation of the bundle interventions. So, our goal is to remove Foley's and have 0 CAUTI. Right? So where to from now? I believe that engagement is the key. You got to have engagement from the unit. It begins with leadership, then unit-based counsel, and then the nurses. So leadership engagement is important. I believe in doing this project that leadership needs to sponsor the initiative. They need to provide education to ensure that the staff is aware, and post current data, hold staff accountable, and obviously celebrate successes, because we will be successful. Right? The unit-based council, I believe their engagement is to establish the bundle, the process to initiate, introduce it to the nursing staff, implement the bundle, report barriers, and celebrate successes. And the nurses also need to be engaged by implementing the bundle and the protocol, being compliant with it, being accountable, report barriers, and of course, in the end, celebrate our successes. We can celebrate a lot because we're going to be successful, right? So how will you evaluation? Our evaluation will be post-current infection rates on the bulletin board in an area where the nurses are aware when they go in for a break or when they're walking by to ensure that they know what our infection rates are. Infection control notification of each occurrence ASAP. Many times infection control doesn't let us know that we had a CAUTI till the end of the month. But it's important for us to talk with them and communicate with them to know, hey, as soon as we have an infection, we need to know so we can address and look at barriers and look at the costs. Daily running on all patients with urinary catheters. Bundle protocol compliance being monitored. Monthly results posted and addressing all barriers. So the outcomes, a consistent reduction of CAUTI. Our goal is 20% improvement monthly. Ultimate goal is to eliminate CAUTI in the ICU and then celebrate milestones 30, 60, and 90 days out as we are successful with this implementation. So in summary, we need to address this because we have an increased catheter usage and CAUTI rate in our ICU. Our goal is to reduce CAUTI in the ICU. We're going to introduce the evidence-based protocol, initiate the evidence-based protocol, leadership, unit-based council, nurse accountability, post results, address barriers, and of course, we're going to celebrate our successes. Any questions? Good job. All right. Thank you.